welcome back to Pelvis Party. My name is Becky Montpetit. I am the owner of Rochester Local, and I'm back with my friend, Dr. Melissa Richards. She is the Division Chair of Hospital and Surgical Services at Olmsted Medical Center. And our special guest today is Sara Ayres. She is the Director of Hospital and Surgical Services at Olmsted Medical Center. Hi. Hi, everybody.
Hi there.
How are you doing?
Great.
Good. So first we have to launch in and say, you two are kind of a dynamic duo, right?
It's true.
You're kind of a dyad together.
Partners in crime.
Right?
Good crime.
Only good crime.
Only good crime.
You never cause any trouble, do you?
A little bit. I think you have to be successful.
We only tell truths here, right?
Yes. I've gotten into the idea of I want to fly a little close to the sun, maybe get a little sunburned, maybe the wax on my wings just melts a tiny bit.
Singe your eyebrows.
Just a little bit. I think we got to fly a little closer to the sun. That's what I'm doing.
Perfect.
That's what we're doing.
Okay, so Sara, you are you do a lot with the nurses at Olmsted Medical Center. Can you tell me a little bit about that?
Yeah, so currently I'm the Director of Hospital Nursing and Surgical Services. So many areas are included in that, including the emergency department, birth center, surgical services, med-surg, and then several ambulatory areas that are within the hospital.
Okay, so that's a real high level look. What does a day in your office look like?
Yeah, excellent. Let's see, lots of emails.
Yep.
Anyway, but I have 6 nurse managers that are my direct reports, and we do a lot of problem solving together, a lot of strategic planning. How can we solve today's world problems?
Right.
So really that's what I do in a day. Dr. Richards and I talk frequently throughout the day of things we can solve. It's pretty great.
Things you can solve, babies that can be birthed,
right?
Women that can be helped, right? And so talk a little bit more about how your working relationship is with you being the division chair, with, practicing in OBGYN and what that looks like.
It's really neat how we have things set up at OMC regarding the dyad partnership. So with most of our leadership positions at OMC, there is a clinician leader and then more of an operations or nursing manager. And it really provides perspective because believe it or not, sometimes clinicians have a perspective or how we're going to get to a place, but we don't recognize the impact in every other area or the ripple effect, or even sometimes Sara will come to me and she'll be like, okay, so this seems really weird. And I'm like, oh no, that's not weird at all. So this is how we're going to navigate through that because that is a very reasonable request. It's reasonable or not unreasonable, which is also something that we all have to think about. And how can we get to where we need to? Because at the end, we are always thinking about our patients, and we're really servant leaders. I would argue that's our leadership style. Is how do we help the people we're working for be successful in taking care of our patients.
Patient-centered, right? Which is Olmsted Medical Center.
Beautiful.
Correct.
Right? Thank you.
Yep.
Thank you, Becky. Yeah. Thank you.
You're welcome. I'm here all week. Okay, so we're going to dial it back a little bit. How did your nursing career get started? How did you start?
Yeah, so I grew up on a dairy farm and nursing was not a thing. I knew nothing about it, and I got recruited to play volleyball, and he was like, I think you should try nursing. Okay.
Who is he?
The athletic director.
Really?
Wow.
Yeah.
Interesting.
Yeah, he came and watched a volleyball game of mine, and I was like, is there blood in nursing? Because Sara Ayres falls to the floor.
So a little bit of blood from time to time. Right.
Yes.
Yeah.
So thankfully I had awesome instructors who were like, let's maybe gravitate you towards this type of patient.
Okay.
So I think that really helped kind of solidify maybe my leadership career too.
Sure.
But I started in psychiatry. And I worked there for about 15 years as a staff nurse and as a nurse manager at a bigger organization. I also have dabbled in nursing education and then was also a nurse manager for a trauma orthopedics floor and then a nurse administrator for neuro rehab services.
Wow.
Yeah.
So you've really had quite a varied career.
Yes.
How would you say all of that experience has lent itself to your role now?
Yeah, I think just meeting a wide array of individuals, because everyone operates a little bit different depending on what specialty you're in. So surgeons may act a little different than psychiatrists.
Oh, I would imagine. Right?
Same with nursing staff. So I think that really helped me solidify what works, what doesn't work, and I like to kind of watch and listen and see what types of behaviors kind of click with people.
Yeah. All right. So you mentioned something about leadership and that being an important aspect of your career and a lot of what you do now. So how does that look in your everyday work with the nurses that you invest into?
I think one of my keys to success is, it may sound creepy, but I like to watch people. So see
like
how,
that. Yes.
see how they,
You're observing.
Observant, yes.
Yes.
See how they interact with their staff. And you can tell a lot about people of how they just communicate. And so that's kind of the first start of how I cultivate leaders. How do they communicate with others? Because that's a lot of this job is communication.
Yep.
So if I'm noticing, wow, they do a really great job with communicating with a wide array of people, okay, I'm going to start investing in that individual. And even trying to invest in people who aren't the most showy or not the most loud or vocal. And really talking to them about their career plans. I do a lot of one-to-ones with individuals. Which is great. And one piece that I have really loved about OMC is the longevity of individuals. And I want to give a special shout out to Brenda Ziegler. She is retiring. Brenda.
That's great.
You just dropped new news on me.
I did.
Yeah.
Breaking news.
Breaking news coming from OMC.
Brenda. I gotta go have another baby just so I can see Brenda again,
I mean,
right?
it's real short timing.
Yeah, do you have like 6 weeks in and out?
No, shoot.
As an OBGYN, I want to just tell you, it's not going to happen.
No.
Yeah.
Oh, shoot. Okay,
No.
thank you.
No.
Anyways, regardless, Brenda, she's wonderful. And talk about longevity, right? So, and I think too, for me as a patient who has been a patient for so long at OMC, I have seen some of the same nurses, especially in women's health, for years. And to me, that is a huge testimony and testament to the type of culture that you develop at OMC, that they want to stay, that they want to not only stay, but develop their careers. They're just like, you know what, we're staying at OMC. I like OMC. I can develop my role at OMC. And I just think when you see that and not so much turnover, it speaks a lot about the culture and values of a place.
I think what Dr. Richards and I do really well is our empowerment of people. We want people to have a voice. We want them to be able to speak up. We want to listen to them. And I just learned a fun fact yesterday. Our retention rate at OMC is 9 years. That's a lot,
That's
you
a
know,
long
for individuals.
That is great.
Yeah.
With having you speak a lot about empowerment, it makes me think about the nursing, career path in general and how it's really dominated by women. And so what I love hearing about when you talk about how you invest into your team is you are raising up a strong female leadership team. And I think that that's amazing. And I love that OMC is just investing so much into developing strong female leaders.
I think it's great. And we love to be very clear, we love our male identifying leaders. They're fantastic and amazing. To be very clear. But leadership of those who identify as women, it's a little bit different. It is, and that path can be a little bit different. And we keep going back to culture. We're creating amazing nursing staff. We're creating amazing clinicians.
Mhm.
And we see that even with like medical schools.
Mhm.
The ratio of men to women, it's kind of flipped a little bit.
Yeah.
So more women are going to medical school. And then let's never forget our patients too.
Right.
Like when you're creating a culture of empowering your people,
Yes.
your employees at OMC, you're also empowering your patients. And
Right.
for us, a large portion of our patient population identifies women.
Yep.
And so it's very important that we are seeing that within ourselves, so then we can also allow our patients when they come in,
Yes.
that they feel like they can bring stuff up.
Yes, and you're empowering them. And as we say, what do we say? Never settle. So it's this effect of having strong people in leadership at OMC, which translates into a strong frontline staff, which translates into empowering the patient.
Well done, Becky. Such a professional. Well done.
Well, all right. Well, Sara, it has been a delight to have you with us. Thank you for all that you do for the OMC team. Thanks, Dr. Richards, for being here. And as always, if you'd like to watch more episodes of Pelvis Party, please head to rochesterlocal.com/pelvisparty.